Good morning. My name is Doris Agu. I am a psychiatric DNP student at Brandman University. I'm going to be presenting on my stakeholder education plan video. So what is my project about? For my project, I am proposing the use of aromatherapy in conjunction with traditional antiemetic medications post-surgery. This is to treat postoperative nausea and vomiting during patient recovery in the post-anesthesia care unit. It will be done over a 1 month period. So some statistics on postoperative nausea and vomiting. It affects 20 to 40% of all surgical patients, with high-risk patients experiencing rates up to 80%. It's a clinical problem that has been linked to patient dissatisfaction, prolonged hospital stays, and extended time spent in the PACU. Post-operative nausea and vomiting is a common occurrence after surgery. It's predominantly seen in patients who are sedated with general anesthesia. It's not a chronic condition, and it can be self-limiting, which is why it's often overlooked. It has serious adverse effects, some of which include wound dehiscence, dehydration, electrolyte imbalances, bleeding, increased intracranial pressure, airway compromise, esophageal tears, and aspiration pneumonia. These complications often result in a delay in PACU discharge, which can lead to costing more money for hospitals. Patients usually don't like to be readmitted into hospitals and have to stay there for extended periods of time. So that's a little information on that. So a brief description of the stakeholder groups for this project. The stakeholders, you guys will be nurses, doctors, managers, directors, and hospital CEOs. According to dictionary.com, a stakeholder is a person or group or organization that has interest or concern in an organization. Stakeholders can affect or be affected by the organization's actions, objectives, and policies. So the nurses in this group of stakeholders will be responsible for administering aromatherapy and training other staff on how to administer aromatherapy, and as well as kind of educate the patients as well. Doctors will be responsible for informing their patients. These will be the anesthesiologists prior to having their surgery about aromatherapy if they are susceptible to having postoperative nausea and vomiting. So they can have aromatherapy as an option. And they can also go over like the benefits of using aromatherapy in conjunction with antiemetics. It would lead to less antiemetic use. Therefore, they won't have the drowsiness. They won't have some of the cardiac effects that antiemetics can cause depending on the patient's history. The PACU director will be responsible for proper implementation of new guidelines and policy approvals. Hospital CEO will be responsible for ensuring all new policies and procedures are coherent with the hospital's mission statement and values. Let's see. The manager will be responsible for approving use of aromatherapy on the unit. So that's the group of stakeholders and their responsibilities. Identifying educational needs for each of you stakeholders would be their nurses and would be required to have BLS, RN, license, pre-op PACU experience, medication knowledge. The doctors would have to have the BLS, the pre-op PACU experience as well, and medication knowledge. Hospital CEO would be more for financial knowledge and medication knowledge as well. Unit director would have to know about finances, pre-op PACU experience, medication knowledge. Manager on the unit would have to have PACU experience and medication knowledge. The implementation of this project will start with the hospital CEO, who will be communicating with the department director and manager to provide approval for the innovation project implementation. After the hospital CEO confirms that the project is beneficial financially, and it does enhance patients' quality of life, gets them discharged earlier, decreases their chances of having readmission, and increases patient satisfaction, the next step will be to introduce the project to the surgeons and the anesthesiologists. So once it's been introduced to them, the benefits will then be explained to them. The doctors will be informed of patient safety and recovery status post-procedure with the use of aromatherapy for post-operative nausea and vomiting. So they will use this information to pass on to their patients to convince them to use aromatherapy when they're in the PACU. Nurses will attend education training sessions, informing them of proper techniques to administer the aromatherapy inhalers, and they will be able to pass this education on to their patients as well. The theoretical foundation and conceptual framework underlying this project, the middle range theory of comfort by Cole Kobat, supports the conceptual framework for this research study. The theoretical foundation to which this project will be modeled after is the comfort theory. This theory represents the condition of being strengthened when physical, mental, and spiritual and cultural needs are addressed. So looking at the whole person, not just their illness or why they came to the hospital. The comfort theory is exemplified in the role of the peri-anesthesia nurse in assessment and management of post-operative nausea and vomiting. Therefore, comfort interventions provided by compassionate and knowledgeable nurses with a holistic focus promote ease, relief, and transcendence. Utilizing this theory while providing care for patients post-operatively can influence and enhance patients' experience and leading to a more positive health result. What stakeholders will be told about the value of the project? Stakeholders will be informed of the value of the project during weekly meetings, which will discuss the prevalence and incidence of post-operative nausea and vomiting on the unit. They'll also be told about the adverse effects noted due to insufficient treatment for the condition. Pertinent information will be presented to stakeholders outlining current treatment for post-operative nausea and vomiting and ways to improve it. Financially and at the bedside. Stakeholders will be introduced to data that summarizes the projected long-term advantages of using aromatherapy as well as long-term advantages of keeping the system as it currently is. How will you as stakeholders be kept informed of the progress of the project? So what we'll do to keep you informed is, like I said, the weekly meetings. We'll discuss the benefits of aromatherapy on the unit, how it's being used, cost analysis, savings, as well as challenges and ways to find ways to work around those challenges or improve upon those challenges. So how can you as stakeholders help facilitate the project? Stakeholders can help facilitate the project by getting involved, asking questions, conducting research, attending meetings, staying current on training, providing feedback, and giving opinions on how they feel about the project and how it's going. This will help make small improvements, and that can basically lead to bigger impacts in the long run. So that's what stakeholders can do to stay involved. Okay, so that was my project, and I'm done.